Is it just us, or do you also sometimes feel that living with someone with diabetes can feel like walking on eggshells on some days? There might be moments when asking them for a simple checkup might make them tear up. Another moment, one advice on their dietary choice can unleash a spate of angry words. But have you wondered what might be making their mood so jumpy? Why do you always feel at the receiving end of this emotional roller coaster ride? Well, it's actually the blood sugar playing mind games. And in this video, we will unravel what truly goes on in the brain when the body has trouble with too much or too less glucose levels in the blood. We already know that diabetes is a condition where the body has trouble using sugar or glucose from food. But why does our body need sugar? Imagine your body is like a car that needs the right kind of fuel to run smoothly. That fuel is sugar, which we call blood sugar. When your blood sugar gets too low, your body sends out emergency signals. It releases special chemicals called hormones, like tiny messengers. One is like a stress alarm called cortisol, and another is like a runaway alarm or adrenaline. These messengers rush into your blood to try and fix the sugar problem. So when you see a diabetic person who is constantly feeling anxious or angry, just backtrack and try to understand when was the last time this person ate food, or if that food choice was poor. There is a probability that hunger might be dipping their sugar levels, causing this mood swing. While being hangry can be a normal one-off occurrence in healthy people, it is essential to control intense bouts of hunger in diabetics because a severe drop in blood glucose level may lead to hypoglycemia and can starve the brain of glucose. Furthermore, diabetics might also constantly feel starved because the blood sugar isn't broken down in the way it should, thus causing lower absorption in cells, leading to a feeling of constant fatigue and hunger. So, what can you do? Consulting a nutritionist who would advise a regulated diet with high-fiber food is what can help keep the dangers of low blood sugar at bay. Continuous monitoring of blood sugar levels and also regular exercise with strength training can improve both the fluctuations as well as mood swings. But it isn't just low blood sugar. When blood sugar levels soar too high, a condition known as hyperglycemia, it can lead to feelings of anger or sadness. In effect, both high and low blood sugar levels can cause harm. And these fluctuations can result in an emotional roller coaster for someone living with a diabetic. Stress worsens this emotional instability. When diabetics experience stress, their body's natural fight-or-flight mechanism comes into play, causing blood sugar to spike. Adrenaline is also released into their blood, heightening alertness to respond to danger. This increased alertness makes a diabetic highly restless and irritable. All of this adds to that notorious grumpy mood. But how is this possible despite medication? Well, that's another layer of complexity. Diabetics rely on insulin and other medications to help manage blood sugar levels. While these meds are super important for keeping everything in check, it can sometimes have side effects that mess with the mood. Insulin is crucial for those with type 1 diabetes, but unregulated high levels can lower the blood sugar way down below, leading to hypoglycemia and that feeling of irritability coupled with anxiety. There are oral medications prescribed for type 2 diabetes, some of which have been linked to an increased risk of depression. Everyone reacts differently to these medications. What works well for one person might not work for another. That's why it's really important for anyone managing diabetes to talk openly with their clinician about how they're feeling while on medication. So now the big question is, what can you do to make things better as a caregiver? First off, remember, when a diabetic is feeling grumpy, it's usually not about you. Their mood swings are often tied to their blood sugar levels. Take a step back and remind yourself it's not personal. This can really help you respond with compassion instead of frustration. If they snap at you, try to let it roll off your back. Holding on to those moments can create unnecessary tension. Instead, think about how they're struggling with their emotions. It's not easy for them either. When you notice the mood shift, approach them gently and speak gently. Let them know it's okay to vent. Establishing this kind of safe space can really help them feel supported and understood. We have also put together 3 quick and easy distraction techniques you could use the moment someone with diabetes starts to feel snappy. Here's how it works. Change the subject. As soon as you notice that grumpy mood creeping in, Gently redirect the conversation to a funny memory or share a light joke. When someone is feeling grumpy, their focus may be on their discomfort, frustration, or irritability. By changing the subject, you create a mental shift that can help them step away from those negative feelings. Suggest a quick activity. Propose a simple activity that can be done in under a minute. Try saying, "Let's take a quick stretch together," or "How about we grab a glass of water?" Engaging in a physical activity, even something as simple as stretching, can release endorphins and shift focus away from stressors. Movement helps to reset both physical and emotional states. Offer a positive observation. Sometimes, all it takes is a sincere compliment to shift focus. When someone is feeling grumpy, hearing affirmations can remind them of their strengths and accomplishments. Instead of generic compliments, try to be specific about what you appreciate. For example, "I really appreciate how hard you're working on managing your diabetes." This shows that you notice their efforts and care about their well-being. Positive observations remind the individual that they are not alone in their struggles and that their efforts matter. Thank you for watching. We hope this video helps you create a more understanding and supportive environment for your loved one living with diabetes. Don't forget to subscribe and hit that notification bell so you stay updated on the latest trends in holistic well-being.